Okay, for this video we are seeing the gel method. We have our gel cards, our pipette, and the dispenser. We also will use 0.8% reagent cells. The tube are usually 3%. So first of all, you want to check your card to see that it's in date. You also want to inspect the wells to make sure the liquid hasn't dried out or damage to them. You always want to label your card with your patient information. For this purpose, I'm just going to put John Doe and label screen 1, 2, and 3. You can use Roman numerals here. We don't mind the regular numerical numbers 1, 2, and 3. So we can just peel back this foil part, opening up the wells. Make sure your cells are also in date. We label our caps because we tend to take them off all at the same time and we don't want to mix them up. Make sure you mix your cells with your pipette. There's different levels of measurements. There's 25 microliters, 50 microliters, and 125 microliters, which we don't use here. But the 50 microliters is used for your cells. So you always want to make sure that that is the measurement that's on the pipette when you go to dispense your cells into the well. We always add our cells first in the gel method, counterintuitive to the tube method. We're going to go ahead and pull up the cells. You need to prime your pipette, getting rid of any air bubbles, and then you go ahead and add cell 1 to well 1. You'll do this for well 2 and 3. Same thing, go ahead and prime your pump and add cells 2 to well 2. Prime your pipette, dispense in well. I'm going to go ahead and recap these. So now that you added your cells, you can add your serum or plasma usually used for patients. I'm just going to use a random patient we had earlier. You want to make sure you switch to 25 microliters. You're going to pull up on the patient plasma. Make sure you prime your pipette as always and dispense it into 1, 2, and 3. So now that we added our cells and our patient plasma and we are ready to incubate, which is usually at 37 degrees Celsius plus or minus 2. You want to make sure it's always in range, and this incubation will last for about 15 minutes. Okay, so my gel card was done incubating and I went ahead and moved it into the centrifuge. Like any centrifuge, you have to balance it and it spins them down. I've already done that because it takes about 10 minutes. So we're just going to move over here and look at our card. So as you see, this was our side of the card, Mr. John Doe here, and his screen is negative. You can see the red cells at the bottom of the well. If they were at the top of the well or throughout these wells, it would be a positive screen, and we would have to move into an antibody panel. We get these grading reaction sheets that tells you the difference between 1+, 2+, 3+, 4+, and a negative reaction. You also get a mixed field picture. This is a really helpful chart if you do have a 2+ or a 3+. But overall, gel cards are very easy, very simple, and that's basically it for a screen in a gel card.